All right, good evening, everybody, and thanks so much for joining our Men's Health webinar. We are so grateful to have the opportunity to share some important men's health education with this group tonight. My name is Amanda, and I'm the host of our event. I'll start with just a couple quick housekeeping items, and then I'll introduce tonight's speaker. Most importantly, your participation tonight is completely anonymous to other attendees. No one can see your face or your name, and any questions that you ask can only be seen by myself and our speaker. We really encourage interactive presentations, so if you'd like to ask a question, please type it in the chat box at the lower portion of your screen, and we'll save time at the end of the presentation to answer as many as we can. Tonight's webinar will be presented by Dr. Akash Kapadia, a urologist and men's health specialist at Wellstar Urology. He specializes in treating a broad range of urologic conditions, including erectile dysfunction, enlarged prostate, Peyronie's disease, and male infertility. We are so fortunate to have his unique skill set right here in Metro Atlanta. Dr. Kapadia, I know your time is in high demand, and I certainly appreciate your willingness to be with us this evening to share education with our community. I will turn it over to you to get us started.
Hello, everyone, and welcome to the webinar tonight. Housekeeping items again. I'd like to thank Amanda and Boston Scientific for hosting this event and giving us, most importantly, an opportunity to connect and talk about a very important issue. And then most importantly, I'd like to thank all of the viewers that are tuning in live tonight. I thank you for your time, and I hope that we can engage in a very meaningful way. And I'd also like to thank all the viewers that are going to watch this video recorded. I hope that you find the information very helpful. And I'd like to encourage all the live audience tonight to ask questions. That's how you all will get to learn and learn in a very meaningful way. And that'll also answer questions for a lot of the folks that are watching this later on. As this talk indicates, we're going to be learning about erectile dysfunction. It's going to be a lot of information that you're going to find very useful. But most importantly, the biggest takeaway for tonight is that I want all of us to sit down and think about erectile dysfunction and think of it as a very, very common problem and a common condition that men deal with across the globe. That leads to us accepting it and perhaps finding a way to talk about it. Because when it comes to ED, if you've got the will, there is a way to fix it. And that's my takeaway for tonight. If you don't remember anything else, keep that in mind. With that said, we're going to learn about what ED or erectile dysfunction is and learn about treatment options. So ED is plain and simple the inability to achieve or maintain a firm erection that is adequate for penetrative intercourse. As I mentioned earlier, it's extremely common. About 1 in 5 American men over the age of 20 experience ED in their lifetime. Data suggests that more than half the men above the age of 40 experience some form of ED, and it affects nearly 40 million American men. That is a very significant number. Before we talk about ED, the treatment options, I think this slide is a big takeaway, and it really will help you understand how treatments work. Let's understand the erection process. So on the slide, as you can see, this is the cross anatomy of a male penis. Right away, you can notice 3 chambers, 3 cylinders that you can see. The 2 up top and a tube down here. If you will, a man's erection is essentially a battery-powered hydraulic system. The hydraulic system has 2 hydraulic chambers, and the battery is the nerves that originate in the brain and the spinal cord, making its way down around the prostate and to the male penis. The battery is what drives this hydraulic system. How does this hydraulic system work? The 2 chambers that are described up here are the chambers that essentially fill with blood. The battery, when it's activated, when a man is aroused, causes the arteries to dilate within a man's penis, as you can see on the right-hand side. This is the inflow system of the hydraulic chamber. What also needs to happen in a hydraulic chamber is that the outflow has to close off. And therefore, as the battery is working to cause fluid to rush in, blood to rush in into these chambers, these veins on the side of the penis start to collapse and close off. A man's penis is perhaps the only organ in the human body that is designed to trap blood. And that's essentially what is happening during an erection. So erectile dysfunction, or ED, is essentially a failure of one, two, or all three of these issues, or all three of these systems that drive an erection: the battery, the inflow, and the outflow. So what causes ED? As I mentioned, ED is extremely common. The real way to think about it is that ED is a disease of wear and tear. It's a disease of aging. In other words, you've got an inflatable tire tube within the penis, and wear and tear causes that tire tube to stop working. With that said, here are some of the common causes that relate to ED. So 40% of the time, there is a vascular cause of ED. In other words, atherosclerosis or plaque disease of the penile arteries, or issues with the venous system of the penis. 30% of ED is actually caused by diabetes. Diabetes is actually a very interesting disease. It not only causes disease in the blood vessels of the penis, but it also damages the battery, the nerves that drive the erection. The other causes include 15% of the time it's medications. So medications, more commonly blood pressure medications. Essentially what they do is they cause leakage in the system. They cause your veins to dilate. And they also cause your arteries to not dilate as much and drive the inflow. And on the right-hand side, you can see a wide variety of other causes that are also implicated with ED. 15 million men in the US have diabetes. This is a very important condition to keep in mind. As I mentioned on the slide earlier, 30% of ED is caused by diabetes. On the bottom hand of the screen, you'll see some of these factoids. Patients with diabetes and ED are less responsive to oral medications. And this makes sense as we talk about the medications later on. Jumping a little bit ahead, medications cause erections by activating the battery and causing the arteries to get bigger. Well, we learned that diabetes damages the battery, and therefore men with diabetes are less likely to respond to oral medications. Usually men with diabetes also have more severe ED. And often, well, in some patients at least, ED can be a presenting symptom of diabetes. Here's another important link between erectile dysfunction and heart disease. It is known in literature and in urology that erectile dysfunction can be a harbinger or precursor to heart disease. There was a very well done study on men with prostatectomy that, when followed later on, showed that they developed heart disease after the diagnosis of ED. It is an independent risk factor for future heart-related events. And the severity of ED, specifically ED caused by disease in the arteries, can be linked with coronary artery disease. And this is why. Here on this picture, you can see the penile artery as compared to the other arteries within the human body. Most importantly, notice that the penile artery is about half the size of the main artery that supplies blood to the heart. And if you understand plaque disease, you know that plaque disease in the heart is a common cause of heart attacks. So when the penile artery is half the size of the heart artery, well, guess what's more likely to be affected first? Usually the penile artery. Another link with erectile dysfunction is low testosterone. Low T occurs when a man's body produces less testosterone than normal. And a lot of men are aware of symptoms of low T that include low libido, low energy, fatigue, issues with the mental status. Low testosterone is more common with men that have obesity, diabetes, high blood pressure, all the things that we commonly hear about as we get older. It's also known that anywhere from 10 to 40% of men in the US over the age of 45 have low testosterone. Here's a little aside on treatments of low testosterone. The point here is that testosterone is closely linked with ED, and if you have symptoms of low testosterone, you should definitely check with your urologist or primary care doctor to check your testosterone levels. I think this is one of the more important slides of our conversation today. What is the link between ED and prostate cancer treatment? So for many of the prostate cancer survivors out there, let's try to understand what's happening here. We talked about the example of the battery that drives the hydraulic cylinders. The battery wraps around this prostate tissue and it makes its way to the penis, causing erections to happen by increasing inflow into the penis. Well, guess what? When you've had a prostatectomy, even when it's nerve sparing, there's certainly changes that the nerves around the prostate go through, and that results in at least temporary erectile dysfunction after a prostatectomy, and in many cases, permanent ED. Also, men that have radiation for prostate cancer are also at a high risk for causing or having damage to these nerves. So data shows that sexual dysfunction after a radical prostatectomy affects anywhere from 25 to 75% of men. And as I mentioned, even with nerve-sparing robotic surgery, ED is common. And a lot of this is predicated by this idea that a man, when he's diagnosed with prostate cancer and has to have surgery, may already be showing signs of erectile dysfunction. And as I mentioned, ED after radiation can affect up to 50% of men. I think this is a very important condition that is recognized more and more in literature and in amongst men. Peyronie's disease. This condition affects anywhere from 6 to 10% of men after the age of 40. Peyronie's disease is a disease of scar tissue formation around those hydraulic cylinder chambers that I talked about. It is fibrous scar tissue that forms around there and causes significant penile deformity. That deformity can be in the form of curvature, of tissue loss, of loss of length and girth and narrowing. So it could be pretty complex, but the important thing to remember here is that erectile dysfunction theoretically can cause Peyronie's disease, and vice versa. Peyronie's disease also weakens the elasticity of those hydraulic chambers, resulting in erectile dysfunction. And if you are having this condition or suffering with this condition, I think it's very important that you seek help from a men's health urologist. Once again, this is one of those conditions, as I mentioned, kind of like ED. It is 100% treatable. So let's, we've talked about many of the causes here. Let's talk about treatment options. Here on the screen, you'll see there are 5 FDA-approved treatment options for ED. And I want to emphasize this concept of FDA-approved treatments. We'll talk a little bit more about what are considered non-FDA-approved treatments and how to approach those treatments. Before I delve into each of them, I'd like to point out a very important fact here. So it used to be historically, we would make men jump through all these hoops to get to the final treatment option. Well, the American Urological Association and its guidelines actually recommends that all these treatment options be offered to patients right off the bat. So, men tend to get frustrated when they can't find solutions to their erectile dysfunction. And I'm here to tell you that there is a solution that's right for you, and it should be available to you right away. With that said, the very first type of treatment that's utilized is a plain and simple pill. Almost all of you guys have heard of oral medications like Viagra, Cialis. There are a couple of others called Sendra and Levitra, which are also available to you. The other 3 medical treatments are injections, vacuum erection devices, and urethral suppositories. Out of these 3 medical treatments, the most highly successful and recommended treatment would be injections. We'll talk a little bit more about the vacuum erection device and urethral suppositories later on. And finally, the only surgical or procedural treatment is a penile implant. And once again, these are FDA-approved treatments. So how do these oral medications work? Well, plain and simple, they work through the nerves to increase blood flow to the penis. Early on in disease, these are highly effective. They work in 60 to 80% of men. There are some nuances to these medications. Food can affect certain types of the oral medications. It is also common to experience one or more of the side effects, and those include headache, facial flushing, upset stomach. And in my experience, men that take higher doses of them tend to have more side effects. Word of caution here, if you're taking nitrates for chest pain, this is not a good solution for you, especially if you're actively taking nitrates for chest pain, as it can cause an unsafe drop in your blood pressure. A factoid at the bottom will show you that almost half of some men with ED who try oral medications give up on them. The reason for that is usually they didn't like the side effects, or the pills either didn't work or just stopped working over time. The way I explain pills to men is if you've got a leaky tire tube, the pills are kind of a patch for a leaky tire tube. Sooner or later, the patch gives out. And as I mentioned earlier, men with diabetes are less likely to see benefit from pills. Another real quick point, if you're a prostate cancer survivor, if you've had a prostatectomy, most of these pills, or these pills mostly work through activating your nerves that then go to the penis. So you can understand why these pills may not work for you if you've had a radical prostatectomy. Intracavernous injection therapy is a highly successful therapy. This is when a man self-injects medication directly to the target tissue. So here we're bypassing those nerves and going right to the artery or close to the artery where action needs to happen, where inflow needs to increase. And that's exactly what these injections do. A simple way to think about them are they're just injectable forms of Viagra or Cialis. The takeaway here is, well, there are side effects of everything. And for this, approximately 40% of men will stop therapy, because as you can imagine, it's not great to have to step away from an intimate moment and give yourself an injection. The side effects of the injections include penile pain, having prolonged erection. In some cases, scar tissue formation that can happen and cause Peyronie's disease, bruising after the injection as well. Most common reasons listed here for stopping are failed erections. And again, this is like a patch for a leaky tire tube. It can stop working at any point, or that you may need higher and higher doses. So reasons of stopping include failed erections, pain, or just not liking the injections because they kind of take away the spontaneity and the freedom that a man requires for intimacy. A vacuum erection device simply creates a vacuum that pulls blood into the penis. I don't find this to be a highly efficacious treatment in many men, especially as a solo therapy, because what men typically find is as soon as you take the vacuum device off, the blood returns back and the erection goes away. It's cumbersome. It makes sex less fun, and that's why men tend to not like it as a therapy. The next medical therapy and the final medical therapy is a suppository or a little medication that's placed into the urinary channel. This is another form of Viagra that's delivered close to to the target tissue through the urinary channel as it disperses into the chambers that we talked about earlier. This tends to be less effective than treatments like injections. It can cause some side effects like genital pain, pain with urination, some bleeding, spotting. In my experience, this tends to be less effective and expensive, and so men tend to use this less often. The final, and the only procedural therapy is a penile implant device. This is perhaps the most permanent and most successful treatment option that's out there for treatment of erectile dysfunction. Before I get too far into the discussion of a penile implant, the one thing I want to tell men right off the bat is that the penile implant is very natural in its appearance, and it's completely internal and completely concealed from the outside of the body. In other words, if you were to go to a locker room with a bunch of guys, nobody would ever know that you've got an implant. If you were to go through security at the airport, nobody's going to ever know that you've got an implant. So how does it work? So a penile implant comes in a variety of forms. For this discussion, we're going to talk about a 3-piece or inflatable penile prosthesis. Piece number 1 is the cylinders that go directly into the penis where your natural chambers exist. Piece number 2 is a pump in the scrotum. And piece number 3 is a fluid tank that's well hidden away from the rest of your genitalia. Erections here are driven by sterile saline rather than blood. And squeezing the pump moves fluid to create an erection. The penis then returns to a flaccid state, just like your natural flaccid penis, once you press the deflate button. And as I indicated earlier, it is highly effective. 98% of patients report erections to be excellent or satisfactory. Most common side effects or complications, genital pain or infection. These are, by the way, very rare complications. And we'll talk a little bit more about it. With any surgery, there's a risk of infection. And then finally, mechanical malfunction. So data shows that at 7 years, 94% of devices are still fully working. If you look at the broader data, the device typically has a lifetime of about 10 to 12 years. So this is another example of a three-piece device. It's the most implanted and the only device that has built-in antibiotic within the system entirely. And by the way, this is not a newfangled device. It's been around and approved for nearly 50 years, 5 decades. 500,000 men have undergone penile implant across the time. So it is a very common solution that exists around us. So here is a nice video that walks us through this treatment option, and I'm going to play this for you. So here, as you can see, there is nothing on the outside of the body to indicate that there's an implant. When you're ready, you press the pump that sits in the scrotum, and you can see that the fluid is driven from the pump into the cylinders, generating a nice firm erection. And when you're done, you press the deflate button that then drives the fluid out of the cylinders back into the reservoir tank. What's important for me to emphasize here is that there is absolutely nothing different about you. The way being intimate feels on the skin is completely normal. Your ability to climax and ejaculate is completely the same as before surgery. You're just able to have erections when you want them and keep them however long you want them. And once again, I should also mention that it has nothing to do with your urinary tract, and so it doesn't change any of your urinary functions. So let's talk about the procedure, the implant procedure in a little bit more detail. This is most often an outpatient procedure. It used to be back in the day that we keep you overnight, but this is an outpatient procedure now. That's done under general anesthesia. It takes about anywhere from 30 minutes to an hour or a little bit longer, depending on some of the risk factors and other conditions that you may have, such as Peyronie's disease. It's usually done through a very small incision, either in the scrotum or above the pubic bone. Generally, a man, I tell a man, you're going to be sore and mad at me for a few days, and you're sort of back to your normal activities within a week. It takes you about 4 to 6 weeks to fully recover, and usually, in most cases, you're ready to use the device at around the 4 to 5 week mark, and sometimes the 6 week mark. In terms of cost and coverage, an implant is often covered by your insurance simply because Medicare acknowledges the value of this treatment for ED and covers an implant. There are some tips and tricks down at the bottom of the screen. I won't talk more about these. If you ever come across this treatment option with your urologist and are interested in this treatment option, talk to them about insurance and exclusions and things like that, and oftentimes they can walk you through a lot of these hurdles. As with any surgery, there are risks of having an implant done, and the risks are listed here. Importantly, you won't get your natural erections once you have an implant, but that becomes a moot point because most men that are opting for this treatment are not getting natural erections without the aid of other treatments. The device can fail, just like any other mechanical device. If a device fails, you can always get another one. There is a risk of 1 to 2% risk of infection with a penile implant, just like any other implantable devices like a hip, knee, or breast implants. To summarize the implant, it carries a very high satisfaction rate. It is affordable and it's particularly covered by most insurances. It is perhaps the most permanent solution, and as I mentioned, it's a concealed solution and makes your life very private. It adds sort of the spontaneity and the freedom and the ability to be sexually active to, in a spontaneous way to many of the couples that have been missing that for many, many years. Finally, I wanted to come back to this idea of FDA-approved treatments and non-FDA-approved treatments. So many of you that may be tuning in are searching online for treatments of ED. And you're most certainly coming across many of these treatments like shockwave therapy and stem cell therapy and PRP. Those ads are notorious, and I know that you've found them as the first things that pop up on Google. The truth of the matter is that a lot of the men's clinics out there are simply preying on men that are looking for treatments for their problems. The American Urological Association makes a firm statement on all these 3 treatments as purely investigational. And so my recommendation to you, if you've come across anything like this, is that you should speak to a urologist or a men's health urologist specifically before you seek treatments at men's clinics. To summarize tonight's talk, let's normalize the conversation on ED. It's common. It affects almost every one of us knows someone that's affected by ED. I can guarantee you that. The other takeaway is that, if you've got the will, there's a way to fix it. There is a solution that's out there for you. If everything else fails, and if you've tried other things and they haven't given you the solution that you're looking for, a penile implant is certainly a long-lasting and satisfying solution for many couples. I want to thank you for your time, and this is my favorite time. Let's talk. Please ask me questions. I'd love to hear more from you and engage in a more direct way.